Did you know that hepatitis C now kills more Americans than all other reportable infectious diseases, including HIV? Well, that is right, and in fact, it's now being recommended that all adults 18 to 79 years of age get tested for hepatitis C, even those believed to be not at risk at all. Here to shed some light on this recent news is gastroenterologist and founder of LA Digestive Health and Wellness, Dr. Mark McConney. Delve a little bit into these new recommendations as far as hepatitis C screening and your thoughts on it.
Yeah. So it's a very exciting time, especially in hepatitis C. What a lot of people don't know is what hepatitis C does to the liver. I kind of call it the silent killer, because a lot of people can acquire this at a young age and they can go 20, 30 years without even knowing they have it. A lot of times the liver enzymes will be normal, they feel fine until they get to the point where they've gotten so much damage to the liver where they present with what we call cirrhosis. And it's estimated that over 4 million people in this country actually have hepatitis C here.
So Dr. McConney, I know that now part of the drive towards screening is because we have much more effective treatments for hepatitis C, correct?
Absolutely. Early in my medical career, when I was in medical school, we only had a couple of treatment options and they were very poorly tolerated. When I was in my specialty training, we came up with these new oral agents. And now, since I've been in practice, we have even better agents. They're called direct antiviral agents that actually can basically, with one pill a day for 8 to 12 weeks, eradicate this virus from somebody.
And that is, I'm going to look at all of you at home and say that is a medical advance that we should not undermine. Having said all that, incredibly expensive, but not nearly as expensive as treating cirrhosis and liver
stole my
failure.
line. Yeah. You stole my line.
Okay, I didn't mean to.
No,
but,
that's fine. Yeah,
but people will look at that and say, well, why does it matter? Because I can't afford $84,000 over a 12-week course for a
we think
pill.
about $84,000, and that's certainly a lot of money, but one liver transplantation from hepatitis C cirrhosis is over $500,000. So when you talk about $84,000 to cure this virus at a young age in somebody who's maybe in their 30s and didn't know and would have ended up with this 25, 30 years down the line, it's a no-brainer.
And I think it's important to point out that if someone does get screened for Hep C and they do need this medication, as expensive as it is, many of these companies at $1,000 a pill still have patient aid programs where they can get them much less expensively. So people shouldn't be thinking that it's $84,000 out of pocket, correct?
Exactly, it's very true. And I've been diagnosing a lot more in my office. A lot of my referring providers, I've been educating them as well. And when a patient comes to my office and I screen for it and I find it, I tell them, I say, we're gonna figure out how to get you treated. I don't want you to feel that cost is gonna be a burden to you, because this is literally changing your life.
Should people be going to their primary care doc and say, hey doc, have I been screened for this? Because you may have been, but
absolutely.
But get screened sooner rather than later.
Absolutely. We do have some risk factors, but again, I think with this recommendation, growing through my education, I've always thought, can we eradicate this virus? And for the first time with all these newer agents, I think if we can screen everybody age 18 to 79, find it early before they get all the complications, treat them, I'm hopeful that in the near future we'll be able to eradicate this virus from all the damages that it does.
And who's at higher risk? IV drug users?
IV drug users are big ones. Blood
somebody
transfusions.
With blood transfusions,
Yes.
potentially tattoos. There's more tattoos
now. Yes, that being said, blood transfusions, they've been screening for it for the past 30 years now, so that's a lot less risk, but you're right. IV drug use has been the biggest risk factor right now. Prior tattoos, although a lot of these tattoo parlors are better now, but I still caution everybody to be very careful. I would like to come back on this show in years to come and to say, remember we talked about this in 2019 and now it's a virus of the history.
Hepatitis. Cool. See you later.
Very excited.
Dr. McConney, thanks so much for being with us.